This presentation is entitled Emergency Remote Learning in Schools During the COVID-19 Pandemic, an example living rapid review, and was recorded for the ECER Conference for the symposium Research Syntheses in the Diverse Research Field of Digital Learning, Methodological Approaches, Dynamic Processes, and Reflections on Open Science. My name is Dr. Melissa Bond, and I must apologise for not being able to be present in person for this presentation. Very quickly, just a little bit about myself to give you a little bit of context. I'm a research fellow and EPI reviewer training and support officer at the EPI Centre at University College London in the United Kingdom. I'm also an adjunct associate professor at the University of Stavanger in Norway, as well as a research fellow at the National Institute of Teaching in England. I'm a member of the Centre for Open Education Research, and I'm also on the editorial board of the new Norwegian Journal of Systematic Reviews in Education, as well as I will be an associate editor for the Online Learning Journal. As we all know, the impact of the COVID-19 pandemic forced everyone to abruptly switch to a form of emergency remote teaching and learning. It became quite clear early on that there was a lot of unknowns in terms of how teaching and learning should be conducted in that remote situation. And it also became obvious that there were a number of research gaps, especially when it came to vulnerable populations, as well as how parents should best assist their children. A lot of teachers and educators, as well as governments, were looking to find out how other countries had reacted, especially those that found themselves in the grips of the pandemic sooner than others. But of course, teachers were in an incredibly difficult situation and really lacked that time to be able to find out the answers to those questions. There were a number of early attempts to try and collate information to inform people about best practices in terms of emergency remote education, but it was really obvious that further synthesis of the evidence was needed to assist both policy and practice. And due to that reason, I made the decision to conduct a rapid review of the evidence. Now, a rapid review is a form of knowledge synthesis that accelerates the process of conducting a traditional systematic review by streamlining or omitting parts of the method, parts of the process of a normal system or a traditional systematic review, so that the evidence can be synthesized and presented in a very efficient manner. Some of the suggested methods for conducting this include limiting your search to published literature only searching one database, using various forms of automation, so for example, using machine learning, limiting the inclusion criteria, such as limiting it to certain dates only or to a particular language, for example, English only research, having only one person conduct the review, conducting multiple steps at the same time, and omitting the quality appraisal step. Now, the research questions for this particular review focused on who, where, and when was the research being conducted, and this was mainly focused on the first 6 months of the pandemic in 2020. What the characteristic methods and topics were in this research that was being conducted, what types of technology had been used or was being used during emergency remote education, how student engagement was being discussed within the literature and what sort of influential factors there were, and what recommendations were being provided going forwards. In terms of applying that rapid review methodology, I chose to limit the number of databases that I was searching. I conducted the review alone. I did limit it to English only research, and I was able to draw on previous reviews in order to construct not only my search strategy, so my search string, for example, but also the data extraction coding tool. And I also chose to conduct this as a living review. So, a review that I would keep up to date at regular times. The databases that I searched included the Web of Science, EBSCOhost, Scopus, Microsoft Academic Graph, as well as looking at ResearchGate, as well as any research that I came across on Twitter. I mentioned that I searched Microsoft Academic Graph, and here I will just mention that I am a member of the Epi Reviewer support and training team at UCL. And so I already had a lot of knowledge on how to use this particular software. But I used the machine learning capabilities within EpiReviewer to be able to conduct citation searching, so snowballing, forward and backward searching, looking in bibliographies of the items that I found, as well as to be able to create auto updates within the system to let me know when new items that were likely to be included in my review based on what I already had, they were flagged for me, and I was able to import them directly into my review. Now, Microsoft Academic Graph is no longer supported, and we have now switched over to using OpenAlex. As I mentioned, I used EpiReviewer to conduct this particular review. I screened 777 items on title and abstract, and then 156 on full text. And my inclusion criteria really did need to focus on research that was conducted in a teaching and learning setting. And it needed to be empirical, and it needed to have been undertaken, of course, during the pandemic. I didn't include any higher education or further education literature, and any secondary research were also excluded. One of the ways that EpiReviewer assisted me in this task was to highlight key terms. So, for example, I selected online teaching, COVID-19, school, teachers, and so on and so forth, so that those terms were highlighted and it sped the process up. I also used the auto advance functionality in EpiReviewer so that as soon as a coding decision had been made on the left hand side, the item then went straight on to the next item to screen. 39 studies were then included for data extraction. And as I mentioned previously, I used previous reviews to be able to construct my data extraction tool. I also used a theoretical framework that I had come up with previously through other primary and secondary research and used those aspects of the framework to be able to extract the data for this particular review. In terms of the rapidness within EpiReviewer when it comes to data extraction, you're able to view the PDFs within the application itself, and you're able to highlight phrases, sentences, paragraphs, and then assign them directly to particular codes, which assisted me when it came time to synthesize the information. I conducted a narrative synthesis, which included tabulation as well as interactive evidence and gap maps and computer assisted content analysis using Leximancer. The interactive evidence and gap maps were created having coded the information in EpiReviewer, then using the freely accessible software EpiMapper, and the maps are available, freely accessible to people, thereby enhancing that open science link, enabling anyone to be able to search them, as well as to export the RIS files of all of the studies in the review itself. And the link is available down the bottom. And that's what you can see once you click on one of the cross sections of information. In terms of the research gaps that was able to be identified, I found a distinct lack of research from Africa, Oceania, the Middle East, and South America. Although this may be due to the spread of the pandemic, which saw, of course, Asia and Europe some of the hardest hit areas. More research was needed on the experiences and preferences of students, particularly in regards, again, to vulnerable populations such as students with special educational needs and disabilities. We found that multimodal production tools, social networking tools, and assessment tools, there was a real lack of research in that particular space, and that is an ongoing theme across a lot of ed tech research. And applications such as Google Classroom, Edmodo, Moodle, and instructional videos were surprisingly less studied than expected. In order to make this research even more accessible to people, as well as to facilitate the living aspect of this particular review, I used Epi Visualizer, which is again a freely available tool for people who use Epi Reviewer. It enables people to come here and search through the various records. So, for example, if you wanted to look for research that really focused on the role of parents, you could click on parents and list records, and all of the records that involved parents as participants will be shown there. People can click on any particular record, show the coding, they can have a look at the information there, as well as the full record with the metadata. The hyperlinks should all be there as well, which will enable people to open that particular study. It is also possible to have a look at the frequencies or to conduct crosstabs within this particular database. And there are a couple of evidence gap maps that are already pre-populated, focusing on different topics. Or people can click on the main evidence and gap map that's available there. And this version was published in April 2021 and provides various details of research that was published at that time. There were certainly a number of benefits to conducting a rapid review, and that would include the fact that it only took me 1 month to conduct the search and the data extraction, and this was certainly very much part time. This wasn't the main project that I was focused on at the time. I was able to use previous reviews as well to construct the search string. And I was able to directly import studies using the Microsoft Academic Graph, which is now OpenAlex, straight into my review in EpiReviewer. By conducting this review as a rapid review, I was able to ensure that the evidence that I'd synthesized and gathered was able to be disseminated far quicker by not only the writing a paper that was published quite quickly, but also by making the evidence and gap maps and the openly accessible web database available to the public as I was conducting the review at the same time, which meant that the information, of course, was current, and I was also able to use that machine learning functionality within EpiReviewer to maintain alerts for when new research was published to ensure that the information going in to the review was as current as possible. There were, however, also challenges, of course. In terms of the software knowledge, that is a challenge. I did already have a lot of knowledge about how to use EpiReviewer. However, I didn't really have the awareness of how to make best use of the machine learning within the software. So, for example, I didn't use something called priority screening, and I'll talk a little bit about that shortly. And had I known this, then it would have been even quicker. Keeping a living review updated can certainly take a lot of time, especially when the topic is a large one, for example, the COVID-19 pandemic. So the advice there might be to ensure that time is scheduled to update the review perhaps once a fortnight or once a month, depending on the situation. And having ongoing access to the software that you're using to conduct the review, as well as the outputs that you're producing, ensuring that people have ongoing access to that can also be an issue. So, for example, the fact that Microsoft Academic Graph was no longer available to the public then meant that there was a lag with EpiReviewer in the switchover between MAG and OpenAlex. There's also been a change where on ResearchGate, they used to have something called projects. It's now no longer available. And so any links that you've made in articles to a research project on ResearchGate, now people aren't able to find that information. So it's really important that you make your outputs available using locations that will be there in the long term. So, for example, Open Science Framework, Mendeley Data, or hosting the information on your own website, and that you know that that's not going to be disappearing anytime soon. Now, I said I'd quickly talk about priority screening. Now, had I known how to use priority screening within EpiReviewer before I conducted this rapid review, I would have found myself in an even better position. After priority screening has been activated for your review, and you've screened roughly 200 items on title and abstract, choose the codes that the machine will learn from and set the screening mode to priority. This process will take about 10 minutes or so to complete for smaller reviews, but it might take a little bit longer if you have a larger number of studies. Now, this doesn't do the screening for you necessarily, but what it does is that it sifts the items in your review and presents the most likely includes to you first. So that what happens is after a certain amount of time, you'll have a look at this screen and you'll start to see a plateau appear. Now, here I obviously imported more studies and then I started doing more screening. So it took the machine again a little bit of time to learn the codes that I'd included. But then after a amount of time, it starts plateauing. And that tells you that the likelihood of any more studies being included is very, very low. And so that really does allow you, if you wanted to, whilst you're doing a rapid review, you could get to this point. Once you find the plateau, you could actually theoretically stop screening and be fairly sure that you're very unlikely to be missing any studies. Again, as I said, unfortunately, I didn't take advantage of this particular feature, and I certainly wish I had done. The other lessons that I learned from conducting this living rapid review is certainly to seek expert guidance if you're able to, and ensure that at least one person on your team, if you're conducting it in a team, that one person has the methodological knowledge required to be able to do this type of review, as well as to use published guidance to assist you. If you're conducting a rapid review, my advice is to keep the team small and to really think about how long it will take you, how much time you've got to spend devoting to conducting the review. If you are in a team, it's a really good idea to ensure that you have a great understanding of the research question or questions, as well as the coding scheme before you begin. And to if you're going to do some single screening or some single data extraction, to ensure that you do some kind of training first on the inclusion and exclusion criteria or the data extraction coding scheme. Of course, using evidence synthesis software like EpiReviewer is a huge tip, as it keeps all of your information in one place, and it can also assist you in keeping your review up to date if you're wanting to have it as a living review. So, for example, the use of OpenAlex. You can also subscribe to auto alerts for particular searches through platforms such as the Web of Science, and that can assist you in identifying potential studies for inclusion. I would also strongly advise you to ensure that you include a Prisma diagram in your reporting and that you utilize machine learning as much as possible. I have a number of further resources that are available to you on the slides, and I welcome you to get in touch with me if you've got any questions at all about the rapid review process or about living reviews or about EpiReviewer in particular as well. Thank you so very much for your attention, and I hope you have a wonderful conference.